Swallowing. I mean, think about it. It's something we all do thousands of times a day, completely on autopilot. But what happens when that simple automatic process just stops working? Today, we're diving deep into a condition called achalasia. It's a rare and pretty fascinating disorder where the pathway for your food basically gets jammed, turning one of the most basic bodily functions into a real daily struggle. All right, so here's our game plan. We're going to treat this like a medical detective story. First, we'll figure out what the problem even is. Then, we'll investigate its root cause. After that, we'll look for the clues, the symptoms. We'll see how doctors crack the case with some really specific tests. And finally, we'll explore the treatments that can actually bring relief. So, let's start with this big question right here. I want you to imagine taking a bite of your favorite food, or even just a sip of water, and it just stops. It gets stuck. It won't go down. That feeling, that blockage, is the core reality for someone living with achalasia. Okay, so to really get what's going wrong, we need to look at the scene of the crime, so to speak. This right here is the esophagus. It's that muscular tube that connects your throat to your stomach. And normally, it's not just a passive tube. It actively pushes food down with these coordinated wave-like contractions. Our entire story today takes place right here. So let's get right to it. What exactly is this condition? Let's define our problem. Right at the bottom of the esophagus, there's this little muscular ring. It's called the Lower Esophageal Sphincter, or LES for short. The best way to think about it is like a gateway to the stomach. Now, in achalasia, two big things go wrong. First, those nice wave-like muscle contractions in the esophagus, they just fail. And second, that gateway, the LES, it forgets how to open. So you end up with a jammed gateway, causing a major traffic jam for literally anything you try to swallow. So why? Why does this gateway get jammed? Well, it turns out it's not really a muscle problem at its core. It's actually a communication problem. It all comes down to some faulty wiring in the nervous system. This right here, this is the heart of the matter. It's not that the muscle itself is broken, it's the communication line that's down. You see, the body has these super specific messengers, parasympathetic nerves, and their job is to tell the esophagus, hey, squeeze now, and to tell that sphincter, okay, time to relax. In achalasia, for reasons we still don't totally understand, those messengers just start to disappear, and without their instructions, the whole system just grinds to a halt. Now, while this condition is pretty rare, we do see some patterns. It usually pops up in adults, somewhere between the ages of 30 and 60, and it seems to be just slightly more common in women. In some parts of the world, it's actually linked to something called Chagas disease, which is caused by a parasite. And in other, much rarer cases, it's connected to a genetic condition known as Allgrove syndrome. Okay, so if the internal wiring is faulty, how does the body let you know something is wrong? Let's take a look at the clues it leaves behind. Doctors are trained to look for what they call the classic triad of symptoms. First up is dysphagia. That's the medical term for difficulty swallowing. And what's interesting here is that it often starts with liquids, even before solids. Second is regurgitation, where undigested food just comes back up. And third, because eating becomes such a challenge, you see unintentional weight loss. On top of that, sometimes there's also chest pain. All right, with these clues in hand, the real medical investigation can finally begin. And doctors have a very specific set of tools they use to confirm their suspicions and get to a definitive diagnosis. The first step is usually something called an upper GI endoscopy. It's basically a tiny camera that lets a doctor take a direct look inside the esophagus. The main goal here isn't just to see what's going on, but also, and this is crucial, to rule out any other conditions that might be causing a similar blockage. The next big piece of evidence usually comes from a barium swallow. You swallow this chalky contrast liquid, and an X-ray machine tracks its path. And wow, this image just perfectly illustrates the problem. You can see how the esophagus above is all stretched out and full, and then it tapers down to this super narrow point at the sphincter. Doctors call this the bird beak sign, and it's a classic, almost iconic visual clue for achalasia. So, a direct look and a clear X-ray, that's strong evidence for sure, but it's not quite a confession. To be absolutely certain to get that slam-dunk diagnosis, doctors need to know exactly what the muscles are, or more importantly, are not doing. They have to measure the pressure. And this is the gold standard test. It's called esophageal manometry. A super thin tube measures the pressure all along the esophagus. Now, I know this graph looks really complicated, but it tells a very, very clear story. Normally, you'd see these gentle, rolling, colorful waves moving from top to bottom. But here, we see this huge, solid block of red, high pressure. That tells us all the muscles are firing chaotically, all at once, instead of in that coordinated wave. This is the definitive proof that the whole system is broken down. All that data from the manometry test is so precise that it lets doctors classify achalasia into 3 different types, which you can see here in what's called the Chicago classification. And this is so important because knowing the type helps predict which treatment is going to work best. For example, type 2, which has that widespread pressure, usually responds really well to treatment. But type 3, the spastic type, can be the trickiest one to manage. Okay. So the case is solved, we have our diagnosis. Now we get to the final and, let's be honest, the most important part, the resolution. How do you go about fixing a jammed gateway? Well, there's kind of a step-by-step approach here. You can start with medications to try and get that sphincter muscle to relax. If that doesn't quite do the trick, the next level up might be minimally invasive procedures, like injecting Botox right into the sphincter, or using a special balloon to gently stretch it open. But for a really long-term, permanent solution, doctors often turn to surgery. And the treatment of choice for a long time has been a procedure called a Heller's cardiomyotomy. The goal is actually pretty straightforward. A surgeon goes in and very carefully cuts the outer muscle fibers of that jammed sphincter. They don't remove the muscle, they just release the tension, permanently opening up that gateway so food can finally pass through into the stomach like it's supposed to. And of course, medical science never stands still. There's a newer, even less invasive technique called POEM. It accomplishes the exact same goal, cutting that muscle, but it's all done with a scope that's passed through the mouth. No external cuts at all. And what's really amazing is that this technique has turned out to be especially effective for that tricky spastic type 3 achalasia we talked about, offering a targeted solution for the toughest cases.